here today in front of the Talking Stick Resort in North Scottsdale, Arizona. It is a gorgeous facility that opened up last year, 2010, to the tune of $440 million. It was opened by Casino Arizona, which is one of the largest employers in the state and one of the most successful. They do everything first rate. There are 2 beautiful golf courses here that are immaculate and impeccable with the greens and the fairways. There are 497 resort rooms, which are beautiful. There's 240,000 square feet of casino space. They have a lot of meeting space, and there's also 4 restaurants. I've eaten at 2 of them, they're great. So I was kind of excited to come out here today. The topic for today is my second installment in the medical marijuana series. First one I talked about an overview of how it came to pass, Prop 203, the initial regulations the Arizona Department of Health Services is placing. All I want to talk about today is chronic pain and medical marijuana. Does it work? If so, how well? Well, in short, to start this topic, the answer is yes, it does work, and no, it doesn't. It depends on what types of chronic pain the person has. Also, because medical marijuana is classified as a Schedule I narcotic in this country, and it's illegal federally, Schedule I means that it has a high risk of abuse, and it also has no medicinal value. Well, multiple states, including Arizona, disagree with that based on the legalization of it, and it's been very difficult to do research based off of those types of restrictions. So what do we know? Well, what we know is that despite very little research, we know that medical marijuana works very well for peripheral neuropathy type conditions. What does that mean? Well, I'm talking about diabetic neuropathy, where you have diabetes and it's running its course and the patient starts to have really bad pain in their hands and feet. You can also get those types of neuropathy from HIV or from chemotherapy as side effects, or maybe radiation therapy. You can also get those types of effects from, that's akin to phantom limb pain, when someone has either a traumatic or a surgical induced amputation. The pain that you can still get even after the limb is gone is called phantom pain. Medical marijuana has been shown to work well for that. These are case reports. These are, physicians asking a lot of their patients, well, how's it working for you? As opposed to like prospective randomized types of level 1 studies. So additionally, you have the peripheral neuropathic types of things. Marijuana has been shown to work in the brain on a separate and different pathway than opiates. So the thought process is that maybe marijuana can act in a complementary fashion to opiates and decrease the amount of opiates necessary to help alleviate a person's pain. And the risk profile that goes along with opiates, including the chance of overdose, addiction, liver problems, especially when you factor in how much Tylenol can be in certain opiates. Also, opiates can have a depressive effect on a patient. They can help with pain, they can also make you depressed. It's the opposite. You want the opposite, right? You want it to help with pain and help you make you less depressed, because back pain can, and any kinds of pain can make you depressed. So those are some of the considerations there. But if marijuana could decrease the amount of opiates that you need to take, then you've kind of won. I mean, marijuana has a much lower risk profile than a lot of opiates. There's never been a fatal overdose reported of medical marijuana. Is it a harmless medication? Absolutely not. There's over 400 chemical compounds of marijuana. We don't know what probably 390 of them actually do. So some of them, most of them probably harmless, but you never know. I mean, it's still sort of a tobacco type product. So you got that to be concerned about. There's also some side effects as far as loss of concentration, potentially, loss of reflex. So if a person takes that and then goes and drives, is that any different than taking Vicodin and going and driving? No. The Arizona House just passed some legislation that allows employers to drug test their employees, and they can fire them if they're positive for medical marijuana and their job performance is significantly being affected. That is no different than if they're high on Vicodin, medicinally or not, and their job performance is being affected. So I guess there's some debate about that potentially, but I don't see it as any different. So The concern with me on chronic pain is that chronic pain is by far and away the most commonly utilized reason for a patient to get a medical marijuana card. So if a patient tells a physician, oh, I have a bad back, I have arthritis in my back, that is just not right now a good enough reason to be recommending medical marijuana. The research doesn't back that up. I mean, there's not a ton of research to begin with, but that just isn't really there, right? So that's kind of the loophole that I'm hoping is going to be monitored very closely. Neuropathic types of pain, going down the leg or whatnot. Here's a for instance. Patient goes and has a back surgery. It goes great. Unfortunately, in a small percentage of cases, you can get scarring around those nerves that were operated on and freed up 3, 6, 9, 12 months later, and that can cause really bad pain that then has no surgical answer for. So you might end up getting like a spinal cord stimulator or be on chronic opiates. Opiates have not been shown to work really well for those neuropathic types of pain. So, I mean, think about it. If you're in chronic pain every day, all day, it's like a pebble in your shoe that just will not go away. You can't play with your kids. You can't keep a job. It's hard to keep your marriage going because all you can think about is how much pain you're in and how miserable you are. You get depressed. You can't earn a living. These are the types of things that happen when chronic pain sets in, and it can ruin somebody's life, make them suicidal. You know, in addition to all the other badness of, you know, you can't make a living. Your self-esteem starts to drop. It's like a gnat at a family barbecue. It keeps flying around your head and you keep trying to swat it away, but it just won't go away. So put yourself in the shoes of somebody like that, a legitimate person with chronic pain. What are they supposed to do? Another surgery has been deemed not to help. Injections help, but maybe only 50%, along with the medications. You're still 50% miserable. What are they supposed to do? Maybe medical marijuana might be a good thing to try for that person to see if they can get, you know, out of that depression or whatnot. Is it so bad? And I'm not advocating this, I'm just asking the question. Is it so bad if medical marijuana has the psychoactive effect of making a patient less depressed who's in chronic pain and helping them become more functional and maybe earn a living and play with their children and you know, save their marriage? Is that so bad? I just posed the question. So you have that, and then you have, you know, there is some research to back up medical marijuana for peripheral neuropathy, and then there's a terminal cancer study out of University of Iowa that showed that medical marijuana dosages of 5 to 10 milligrams was equivalent to 60 milligrams of Vicodin. 60 milligrams of Vicodin is a heavy dose, so the answer is yeah, that's actually a very efficacious method of utilizing medical marijuana. So some food for thought. A lot more research needs to be done, but there are some definite indications